I'm Dr. George Flynn, and welcome to In-Depth TV, where today we're going to talk about mammography in association with the COVID-19 vaccination program. Now, mammography, as we all know, I hope we know by now, is a lifesaver. It determines and diagnoses breast cancer far before you can feel it, far before you know that anything is wrong. Mammography is the cornerstone of early diagnosis of breast cancer. I want you to make sure you're getting your mammograms. Now, males and females can get mammograms, especially in males if they feel a lump or a breast mass. But routine screening mammography is what we're talking about. And the guidelines have been developed. I believe that you should get one, a baseline at age 40, females at age 40. And if you have a family member, a mother, grandmother, somebody that's had breast cancer, you're at higher risk, you probably should get your earliest mammogram at age 35. Get a baseline at 35, and then progress up. And you should get a mammogram every year. Some people are trying to say every 2 years. I believe in yearly mammography screening. And that way, you can be sure that you're going to catch it as soon as possible. Now, that's what we're trying to do. But what's happened recently is we have the COVID-19 vaccine. It's been developed. You know, COVID-19 infection, then we've developed a vaccine, and we have some vaccines that are being released into the market. And they're on emergency use. And what we're finding is some changes in medical imaging, especially mammography imaging. And the Society of Breast Imaging has put out a paper, and we talk about axillary adenopathy. And axillary adenopathy is enlarged lymph nodes. They're seen in the axilla, under the arms, enlarged lymph nodes. And usually, adenopathy, we can see some small lymph nodes, but adenopathy is seen in about 0.04. That's 0.04% of screening mammograms. And we just need to be aware it's a very small percent of the population that are having screening mammograms. And what has been found is when you get the Moderna or the Pfizer or even the Johnson & Johnson vaccine, when you get these vaccines, and the ones that probably will be developed and instituted, when you get the vaccine, people talk about their arm hurting after the vaccine, whether you get it in the right or the left. One arm will hurt. And you may feel a little bit, like headachy. You may feel like you got a cold. You may take some pain relievers like acetaminophen. That's Tylenol. That's one of the brand names of Tylenol. Tylenol is the brand name of acetaminophen. So what we're saying is you might get a little reaction. And I'm saying that's great. What that means is your body is developing immunity. That reaction, that soreness, that little bit of soreness that you get, whichever arm you get your vaccine in, that reaction helps you know that vaccine is working. And sometimes you can get a little bit of adenopathy or enlarged lymph nodes under your arms. Now, your grandmother, your great-grandmother told you, if a lump comes up, it's fighting infection, especially if you've got a cut or a sore. But if a lump comes up like that, it's fighting infection, then it goes back down once the antibodies have developed. But what we're saying is sometimes you can get adenopathy or enlarged lymph nodes under the armpit on the same side of the arm that you got the vaccine. And you can get that. And it's been shown that with the Moderna vaccine, you get about 11% of patients that are having screening mammograms will have a enlarged lymph node in the axilla or under the arm. Now that's after the first shot. After the second shot, you can have almost 16% of people will develop enlarged lymph nodes versus about 4% that have not had the shot. So it's about 4 times more. 16% develop transient or time-limited adenopathy. And what we're finding out is that you should tell, if you're getting your mammogram, you should tell somebody that you've had the first shot, the second shot, where you are in the process. Now, the recommendations we'll get to in just a minute, but just make sure you tell somebody, I had my COVID shot on the right side or the left side, and I had it 2 weeks ago, or I had my second shot a month ago. Whenever you had your shot, be sure and tell them when you're getting your screening mammogram. This has no way you should delay your screening mammogram. No ways you should put it off a year. You can put it off a month maybe, but please go get your screening mammogram. And I've got some guidelines and suggestions for you in just a minute. Screening mammography is necessary. What we're finding is that more and more younger and younger people now that the vaccine is rolling out are getting vaccinated. And I absolutely tell you, please get vaccinated. Please get vaccinated because this is so important to you, your family, your community, your nation. We've got to stop this COVID-19. And I know I hear about the mutants and the variants and things. No, get your vaccine so that we can stop COVID-19 dead in its tracks. But after you get your vaccine, what's being found is you can have an enlarged lymph node. Now, in mammography, you can see an enlarged lymph node, and you can get an ultrasound of the underarm or the axilla, and you can see the enlarged lymph nodes. Now, what happens is we have some recommendations on this. What you should do first. First of all, if you're going to take the vaccine, be sure when you go get your mammogram that you tell them when you've had it, whether you had it on the right side or left side, and this is just what we say is vaccines of all types can result in temporary swelling of lymph nodes. And that's well known. Not just the COVID vaccine. Vaccines of all types can do it. This may be a sign that the body is making antibodies in response as intended. Now, I'm talking about measles, mumps, rubella. All vaccines can do it. So COVID-19 vaccine is no different from other vaccines. And the second thing is when we're doing mammography, and I do it every day, I can see unilateral or one-sided enlarged lymph nodes. And this would be, we've got to document, did you have the COVID vaccine? Was it on the same size that we were seeing the enlarged lymph nodes? If so, what we'll do is we'll recheck it in about a month or a month and a half. Now, we do not have to do another mammogram. We can do an ultrasound, and we can follow the lymph node, no radiation, no compression of the breast, and we can follow the lymph nodes and the axillary adenopathy. With the ultrasound, we can follow the size of it. After we look at this unilateral lymph node, we follow it for sometime between 4 and 12 weeks later, but 4 weeks is usually enough, and we'll see the lymph node getting smaller, and we'll know it was related to the COVID-19 vaccine. If we see the lymph node getting larger, we'll do a simple needle aspiration of it. It's like the same kind of needle that you have blood drawn, and you can do a needle aspiration of the lymph node under ultrasound guidance, make sure that we're getting a good sample, and we send it off, and it'll probably come back reactive lymph node. But I would suggest that if you're going to get your COVID vaccine and you've got to, they're signing up for dates to get it, have your mammogram before you get the vaccine. Just go ahead and have it. But then after you had the second dose of the vaccine, make sure you wait about 4 weeks. If you have a mass, if you have any kind of worrisome lump, discharge, anything that you think is wrong, have your mammogram right now, right away. Do not delay the 4 weeks after the second shot. Just go ahead and have your mammogram. We'll work out the challenges after that. But what we're saying is, everybody knows that the COVID-19 is very dangerous and you need to be vaccinated. But we've found out that with mammography, it can show some evidence that you've had the vaccine, and it can show a lymph node or the lymph node response under the arm. And we see that, and if we know you've had the COVID-19 vaccine, if we see enlarged lymph node, remember, it's going to be 11% of people after the first shot and about 16% of people. So, there are a lot of people that won't have it, will not have the enlarged lymph nodes. So it's about 16% will have the enlarged lymph node after the second shot, 11% after the first shot. So what it means is we expect it, we'll see it, we'll deal with it, we'll wait the 4 weeks, we'll get an ultrasound, and we'll see it getting smaller, and we'll watch it get smaller, and to the point that it becomes a very small, insignificant lymph node. Once that happens, we're home free. But do not let all of the news articles coming out, do not let them scare you. I wanted to take this time to totally explain it to you. Remember, COVID shot, first shot can cause about 10 or 11% of people to have an enlarged lymph node on the same side as the shot. Second shot, about 16% of people will have an enlarged lymph node on the same side as the shot. Then we're going to see that on a mammogram. We're going to, you have told the people doing your mammography that you have had a COVID shot, whether you've had 1 shot or 2 shots, which side you had it on. So that way, when they see the enlarged lymph node, it's on one side, not on the other side. When you see enlarged, it's called unilateral, one side adenopathy, then you know to watch it. Then you know to follow it up in about 4 weeks. We'll look at it with the ultrasound, or if you really want another mammogram, we can do a diagnostic mammography or a spot magnification view on one side and look at the axilla. But we can follow it with the ultrasound and watch it get smaller and smaller and smaller. And you know your immune system is working just as planned, just normally. Now, if these lymph nodes begin to get bigger and bigger, what we might do is do a needle aspiration of it, and that's the same kind of needle that they use to draw blood for blood samples. So I hope this helps you understand adenopathy and the COVID-19 vaccine, things you're going to be reading about, hearing about on the air, so that they don't scare you. That's our mission here, so you understand what's going on and you're not afraid to get a mammogram or get the vaccine. Go ahead and get your mammogram, get vaccinated, and make sure that you've taken care of yourself, your family, your church, your organizations, your social group, and make sure you take care of yourself first. Thank you very much, and I'll see you next time.